Welcome to Sports Doctor. Sports Doctor is a live presentation, so we encourage you to call into the show and ask your questions on injury, rehab, training, or technique. We'll be taking your calls shortly. Call 767-8884 for your direct line to Sports Doctor. Here's your host for tonight's program, medical reporter Joe Chapana.
Good evening and thank you for joining us for another edition of Sports Doctor, brought to you by Cross Keys Physical Therapy Sports Medicine Center in Sicklerville, Woodbury, and Berlin, and a new location coming soon to Washington Township. You get a sprain or a tear or a break or something replaced, they're the guys that get you back into shape. And tonight we are talking about general sports-related injuries, whatever they are. Whatever your injury, whatever your sport, we want to hear from you tonight. Taking your questions about general sports-related injuries, we have Dr. Peter DeLuca, who's an orthopedic surgeon with Booth, Bartolozzi, Balderston Orthopedics and Sports Medicine. They are the sports doctor for the Eagles, the Flyers, the Phantoms, and the Kicks. And also joining us tonight from Cross Keys Physical Therapy, Dave Anselmo, who is a physical therapist with the group. Thank you for joining us, gentlemen. Thank you. And Dave, we'll start with you because this is the time of year, weather's getting warmer, people are back trying to get back into shape again. What advice would you give to someone who's been laying low for the past few months and is trying to get back into an exercise program?
Well, I highly recommend anyone that has not participated in any type of physical activity or sporting event in several months, or some could be several years. I highly recommend them to see their family physician first to get a medical clearance for any type of underlying factors that might limit their ability to be able to participate in a sporting event or activity like that. Just for problems like cardiac problems that might lead to a heart attack and could lead to death, obviously, or orthopedic problems which could lead to injury.
Okay.
So I highly recommend, just for safety reasons.
So see your doctor first. After you see your doctor, what's good about any exercise routine? What are some things you should keep in mind as you're starting again?
Always flexibility. I can't say it enough. You always should stretch and always warm up before doing any type of exercise program. Getting the blood through the joints, loosen everything up, and it helps to prevent injury.
Okay, we are talking about general sports-related injuries tonight. One of those that you hear so often about is the ACL. And Dr. DeLuca, we're hearing a lot of female athletes, especially adolescent female athletes, are prone to ACL injuries. What might be some of the reasons this is happening?
They are prone to ACL injuries, and there's a lot of different theories about it. There's about 6 times higher incidence of ACL injuries in females than in males. A lot of research has been dedicated to that right now because of such a high incidence. The theories currently available, one is that as a female starts to go through puberty, their pelvis gets a little bit wider, which causes increased torque at their knee and more stress on the ACL. That's one theory. The other theory is relative to their body size, they have weakness, particularly of their hamstrings, which protects the ACL. One other theory is circulating hormones. And there was a recent study that showed that during ovulation, they actually had a higher incidence of tearing their ACL than during other times of the menstrual period. Another theory is the absolute size of the ACL appears to be smaller in females than in males. So right now we don't have one particular cause of it. There's a lot of different theories that are being worked out.
Is there anything female athletes can do to prevent an ACL injury?
Well, because of that one study that did show that their hamstrings are weaker, most rehab now or prevention is geared towards strengthening the hamstrings and also proprioception, which is just learning about balance.
Balance, okay. And let's talk about rehabbing after an ACL ligament. Dave, what is the length of rehabilitation following the ACL surgery?
Let's talk to Dr. DeLuca a little bit at this before the show, and it's very difficult to say, but it depends on several factors. First of all, what graft did they decide to use? First of all, it plays a part in it as well. Did they use the patella tendon graft, which is a graft that the surgeon would use actually a part of the patella of the patient, which is another surgery altogether, which usually slows down the rehab process about 2 to 3 weeks. So it's another area which we need to address in rehab. That's one thing. Second one is basically what kind of condition was the patient prior to coming into the rehab. We know that the patient, statistics show us that the patients that are in better condition rehab back faster because they have healthier soft tissue, better blood supply, better flexibility, better muscle tone. leads to quicker rehab. Also, was the patient compliant? Meaning, did the patient come in 3 times a week as the physician prescribed? If they did, they're likely to rehab back faster. If they didn't, well, then they're not going to rehab back faster. Did they do their home exercises? So these things all together, combined, gives you a result of probably about 6 to 8 months.
Got to do that homework if you are in rehab. Let's put up the phone numbers here. Again, we're talking about general sports-related injuries, the knee, the shoulder, the back, whatever. 1-888-634-7488 is our toll-free number. You can dial that up, and we'll talk to you momentarily. Also, a local number is 856-767-8884. If you're more comfortable with email, you can email your question to us, too. Our email address is wpsjtv@aol.com. Again, Dr. Peter DeLuca with us, an orthopedic surgeon, and also Dave Anselmo. And Dr. DeLuca, Dave referred to the type of replacement used in an ACL. First of all, outside of the patella tendon, what other options are available?
There are 2 groups of options. One is what we call autograft, which is a material from your own body, and the other is allograft, which are materials from a donor or a cadaver. From your own body, the choices are the patella tendon, which is probably the most common material that's used for ACL reconstructions in America. The next most common autograft is the hamstring tendons. They take 2 of the tendons from the back of the leg and basically fold them over 4 times to get the same type of diameter as you would for the patella tendon. There are some people that are using the quadriceps tendon, which is the tendon up here on top of the kneecap instead of the patella tendon, as another treatment option or graft option.
As a doctor, how do you decide which graft to use?
I leave it up to the patient. I think they have to be informed of the risks and benefits of both type of grafts, the allograft and autograft, and they have to make an educated decision. I really don't feel like I should be able to sway them either way. They have to be comfortable with it. They ask me questions like, what would I do? You know, if it was your son, what would you suggest to them? But I always tell them at the end, it's ultimately you're the one that has to be comfortable with it.
Are a lot of people weirded out with the cadaver?
It bothers some people. There's no doubt about it, and I think that's why I tell them they have to be comfortable. As soon as I mention it, especially to an adolescent, they all do the same type of response. Ooh, I mean, a dead piece of tissue in me? I don't know. But when they hear about the faster rehab, like Dave said, you know, allografts definitely rehab a lot faster than autografts do.
And that's because you're not weakening another body part of your own, is that why?
Exactly, that and a combination of the smaller incision. The whole operation is done through an inch incision.
Okay, and since we're talking about ACLs, Dave, what sports do you see most ACL injuries in?
Well, basically any sport where the foot is in a planted position and cutting is involved. For example, like basketball, football, soccer, sports like that, where your foot is planted and start cutting starts to get involved. It really puts the stress on that cruciate.
It's that rapid kind of change speed and change direction kind of movement that is giving people problems with their ACLs. General sports-related injuries tonight, the ACL, the knee, the shoulder, the wrist, whatever. 1-888-634-7488 is our number. If you have questions about maybe an injury you've suffered, you can dial us up toll-free. Also, 856-767-8884. Our email address, wpsjtv@aol.com. Dr. DeLuca is with us. He's an orthopedic surgeon. And Dr. DeLuca, when treating an injury as a doctor, does it make a difference if the patient is an athlete or a weekend warrior?
No. It's the same injury, same anatomy that has been disrupted, and you treat them the same way. You give them informed consent about the various options that they have available to them. I think the treatment and what you suggest is the same. What might be different is the rehab afterwards. That professional athlete is going to get intensive rehabilitation 7 days a week. I mean, they're required to be in that training room about 5 hours, 6 hours a day. Whereas the weekend warrior has a job. He's got to pay the bills, and so he's working, and he only gets to therapy maybe 2 or 3 times a week. So you'll see the athlete might be able to come back a little bit faster because of that intensive therapy as opposed to the weekend warrior. But the actual treatment and the decision-making process is the same.
All right, listen, we need to take a break. You're watching Sports Doctor. We're brought to you by Cross Keys Physical Therapy Sports Medicine Center. Talking about general injuries, we've been hitting on the ACL. We're going to move to the shoulder. Also, we're going to take some of your phone calls at 1-888-634-7488. It is Sports Doctor. More of our program right after this.
Hi, I'm Kevin Ross from the Kansas City Chiefs. When I need physical therapy, I chose Cross Keys Physical Therapy, one of the leading rehab centers in South Jersey.
Cross Keys Physical Therapy offers aquatic therapy programs that will help you strengthen weak muscles and improve your flexibility. Our highly skilled physical and occupational therapists are experienced with working with athletes and non-athletes alike. So if you need to get back to work or back to play,
Cross Keys Physical Therapy.
Sicklerville, Woodbury, and Berlin.
get a job.
Look, it's a giraffe.
I don't see it.
The less art kids get, the more it shows. Are yours getting enough? Art. Ask for more. Americans for the Arts.
It is Sports Doctor, brought to you by Cross Keys Physical Therapy Sports Medicine Center in Sicklerville, Woodbury, and Berlin. I'm Joe Chapano. We're here every other Thursday night at this time. We are live. We're with Dr. Peter DeLuca, who's an orthopedic surgeon with Booth, Bartolozzi, Balderston Orthopedics and Sports Medicine. They treat the Eagles, the Flyers, the Phantoms, and the Kicks. And also Dave Anselmo is with us. He is with Cross Keys Physical Therapy. He is a physical therapist there. Our number is 1-888-634-7488. If you have questions about any type of sports-related injury you want to talk about. Also, a local number is 856-767-8884. Our email address, wpsjtv@aol.com. Let's talk about the shoulder. And Dr. DeLuca, why is the shoulder such a problem?
The shoulder is a problem because it's inherently an unstable joint. It's the best analogy that I always tell patients, it's like a golf ball sitting on a golf tee. The humeral head is so much larger than the socket that, I mean, a good wind can knock a golf ball off, and it's the same thing with the shoulder. Most joints rely on their bony architecture for stability, but since the shoulder doesn't have that, it relies more on ligaments, which are more prone to injury.
And what are some of these injuries that you see with the shoulder?
Dislocations, something called subluxations, where the shoulder partially comes out of the joint, rotator cuff injuries, and injuries to the AC joint, which is right where the collarbone meets the end of the shoulder blade, right here. Some people call that a separated shoulder, but it's a bit of a misnomer because really it doesn't involve the shoulder joint at all. The shoulder joint is here, not up here, but that's another common shoulder injury.
We're going to get to the difference between separated and dislocated in just a second, but first a phone call on the line from Cherry Hill. Janine, are you there?
Hello.
Hi, Janine. Welcome to Sports Doctor.
Thank you. I'd like to know if a gymnast has an ACL injury and she gets it repaired, can she go back into, or should she just give it up?
A gymnast with a repaired ACL, does she have a future in gymnastics?
Oh, absolutely. I mean, that's the reason why we do what we do, so the athlete can get back to their activity. A lot of people don't understand that you don't need an ACL for normal activities of daily living. You can function just fine without an ACL. You're at some risk of re-injuring the knee if you don't get it fixed, but absolutely she can go back to gymnastics and probably be just as good as she was before.
What actually does the ACL do? And maybe, Dave, you're in front of the model. Maybe this is one for you. Or Dr. DeLuca.
Okay.
The
The ACL, ligaments connect bone to bone, and the ACL is the one in the center of the knee. It connects the tibia to the femur, or the shin bone to the thigh bone. The one in the back here is the PCL, and cruciate means crisscross. One goes this way and one goes this way. They all have various functions, and the ACL, the way it functions is to prevent the lower leg from coming forward too much and rotating inward. So when people don't have their ACL and they plant their foot and they change directions, their knee does this. We call that subluxation. Years ago, they used to call it a trick knee. Some people call it giving way.
So are they prone to falling, or what?
They can fall. They can injure. Mainly, the reason we get so upset about ACL injuries is that they can damage other structures to the knee, particularly the meniscus, which are the cushions inside the knee, and the joint surface cartilage. When that starts to get damaged, we don't have a good solution for that yet in orthopedics, and that's a permanent injury, and that leads to osteoarthritis.
And what might someone who has this reaction, what does the knee swell up, or what does it do?
Depends on the force that's involved. Some people get subtle subluxations, such as coming out of their car. They'll feel their knee kind of move. They won't get swelling after that. But if they try to go back to a sport with an ACL deficient knee, then yes, they will probably fall, like you said, and also get swelling afterwards.
Okay, the ACL, just one of the many sports injuries we're talking about tonight on Sports Doctor. General-related sports injuries tonight. Almost an open forum, if you will. 1-888-634-7488, our toll-free number. Locally, 856-767-8884. Back to the shoulder. We talked about separation and dislocation. Are they two different things?
Yes. Like I said before, a dislocation involves the, if you will, the ball and socket joint, where the humeral head and glenoid meet. And the humeral head and glenoid are held together by ligaments. The other structures that hold it in place is the labrum, which is a rim of cartilage. It's hard to see in this model, but it actually deepens the socket a little bit. And when a shoulder dislocates, the most common direction is it comes out the front. And that's usually with your arm in this position. That makes you more prone to dislocating your shoulder coming out the front. The least common is coming out the back, and that usually occurs when your arm is like this and you get a force directed posteriorly. A separated shoulder is where this joint here, where the collarbone and acromion meet. Another term for it is AC joint. A for acromion, C for clavicle. It's an actual joint, which means it has ligaments attached to it, and also it has a cartilage in between. And that usually occurs, a shoulder separation, when you fall directly on the tip of your shoulder, and then you have these ligaments here that hold the collarbone down, and they pop up, and this collarbone then elevates itself.
Now, I understand that this is common in hockey. You treat the Flyers. Do you see a lot of separated shoulders in that sport?
Very common. And it's mostly due to getting hit into the boards, your shoulders down, and you get that hit into the boards. There's different grades of shoulder separations. There's grades from 1 to 6, and obviously 1 is the least severe, 6 is the most severe. Most injuries in hockey are usually grade 2 to grade 3 injuries, which are not treated operatively. They're treated with a period of rest, some anti-inflammatory medication. They usually have an elevated collarbone. I mean, if you look at them straight on, you can see definitely a deformity, but they don't lose any function. And they usually come back within 4 to 6 weeks. They have no loss of strength and usually no pain.
When surgery is involved, what do you do?
For a separated shoulder?
Yes.
What we need to do is basically reconstruct these ligaments here called the corticoclavicular ligaments. That's the ligaments that connect the collarbone to this bone that protrudes out of the shoulder blade. We take off the end of the collarbone, and we usually use this ligament here, because this is a ligament that we don't really need. We detach it from this part of the acromion, weave it through the undersurface of this bone, and then tie it down.
Okay, and Dave, what is rehab like for someone who undergoes a procedure like that?
Well, basically you're looking at what the limitations are. We're looking at making sure the patient continues to maintain the range of motion, decrease the swelling, and help them with their strengthening if they have any type of limitations with that.
Okay, back to the phone lines we go. It's 1-888-634-7488 to reach us live. Our next caller is from Voorhees. The caller's name is Chuck. Chuck, are you there?
Yes, I am.
Chuck, welcome to Sports Doctor. Your question tonight?
Yes, thank you. I'd like to have somebody explain to me exactly what a shin splint is.
A shin splint. What is that?
A shin splint is a reaction of the periosteum of the bone. The periosteum is the outer covering of the bone, and it's where the tendons attach. Particularly the tendon that's involved with a shin splint is the posterior tibialis tendon, and it attaches to the posterior medial aspect of the tibia, right along this border. And it has to do with overuse, basically. You get a lot of pulling of that tendon right at insertion into the bone, and it causes an intense inflammatory reaction, and so you're tender over a wide range of area. The way we treat it is usually with a stretching program or anti-inflammatory medication and rest. The things you have to rule out with a shin splint is a stress fracture, because they can mimic each other. The difference is a shin splint is usually more diffuse in its pain, whereas a stress fracture is point tender.
We should talk about stress fractures, and maybe we'll do that in just a second. But first, back to the phone lines we go, 1-888-634-7488. Bill is on the line from Cherry Hill. Bill, are you there?
Hi, how you doing?
Good, how are you doing?
All right. I actually happened to roll my ankle about a month and a half ago during a track meet, and I didn't, it's still having, residual, pain that's hurts every time I start running. I didn't know if there's any kind of exercises I could do to strengthen it back up, or anything I should be not doing.
Was that your ankle, Bill?
Yes.
Okay. Someone who rolled his ankle?
Well, it's really kind of tough to say what's going on with the ankle. Rather than giving you advice of what you should do, it would be a good idea to come in and let us take a look at it first, and maybe help you out in that sense to see what's going on. So you might be a good patient to come in for the free evaluation.
You know, I don't think I mentioned about the free evaluation offer yet. Okay. And Cross Keys Physical Therapy is offering free evaluations for the next 2 weeks. And someone like Bill, for example, rolled an ankle, wants to have somebody look at it, ideal candidate for this. All you have to do is call and schedule your appointment for that free evaluation, and we'll give you the numbers to do that at the end of the program. Right now, though, let's give you our toll-free number to reach us with your questions at 1-888-634-7488. General sports-related injuries tonight. We have Dr. DeLuca with us, and also Dave Anselmo from Cross Keys Physical Therapy. We're going back to the phones right after this.
Hi, I'm Kevin Ross from the Kansas City Chiefs. When I need physical therapy, I chose Cross Keys Physical Therapy, one of the leading rehab centers in South Jersey.
Cross Keys Physical Therapy offers aquatic therapy programs that will help you strengthen weak muscles and improve your flexibility. Our highly skilled physical and occupational therapists are experienced with working with athletes and non-athletes alike. So if you need to get back to work or back to play,
Cross Keys Physical Therapy.
Sicklerville, Woodbury, and Berlin.
And we are back. It is Sports Doctor. We're talking about general sports-related injuries tonight. We're brought to you by Cross Keys Physical Therapy Sports Medicine Center in Sicklerville, Woodbury, and Berlin. Yes, they're offering free evaluations for the next 2 weeks. Hang on, we'll give you the numbers to schedule that appointment at the end of the program. Right now, we'd like to give you our email address, which is wpsjtv@aol.com. Also, our toll-free number to reach us with questions about general sports-related injuries, 1-888-634-7488. Locally, it is 856-767-8884. Just had a caller from Cherry Hill allude, or actually you alluded in your response to him, to stress fractures. Dr. DeLuca, what are stress fractures?
Stress fractures occur when the forces are greater than the bone can handle, and it's usually from some sort of repetitive activity that the person's doing. We see it most commonly in long-distance runners.
We'll get to treatments for that in just a second. Let's go back to the phone lines real quick, though, and talk to Jackie from Cherry Hill. Jackie, are you there?
Yes, I am. How are you?
Good. Thank you for watching. We're talking about general sports-related injuries tonight. What do you have?
Back in '88, I had an allograft performed on my ACL. I had a cadaver transplant, and it actually failed, and they are looking to do some type of knee surgery to do the ACL repair again. What kind of are they doing now that you don't have a high chance of it failing, where the ACL stays tight and your knee doesn't constantly be giving out on sports?
Okay, a question about the ACL surgery?
Mm-hmm. One thing is you have to find out, why did it fail? I mean, was there another injury involved or not? The most common reason for ACLs failing is that there's a repeat injury. The ligament that's put in, whether it's your own or a donor's, is not stronger than what you were born with. So it's going to take just as much force to rupture it. If, on the other hand, it just stretched out, then that's a problem that you may want to talk with your orthopedic surgeon about and talk about different treatment options. If you did not use your own patella tendon before, you can use that. The allograft tissue that we use is basically the same. Nothing has changed since 1988. The only difference in 88, we used a little more what's the word I'm looking for? We treated it with radiation to eliminate some viruses. And we don't do that anymore because that weakened the tendon. So you may want to talk to him about the various other options.
Okay, and as spring, summer sports come upon us, Dave, what are some injuries that athletes should be aware of?
Well, basically sprains and strains. You really want to, as I alluded to earlier, you really want to work on your flexibility. You want to make sure that, especially the weekend warriors, when you come out there, you really want to make sure you warm up properly. Do some stretching, do a little jogging in place, get the blood flowing through the joints. Just like your car, you want to warm up your engine before you get racing down the road. You want to do the same thing to your body. And the best way to do that is to warm up, get the blood flowing through the joint, and it helps you to avoid injury, stretch.
Okay, because the summertime is just about here. I want to give out the numbers for Cross Keys Physical Therapy Sports Medicine Center. Again, they're offering free evaluations for the next 2 weeks. If you've suffered one of these injuries we referred to, or maybe something else, you'd like to have someone take a look at it, by all means, schedule your free evaluation today. In Sicklerville, the number is 856-728-1900. In Woodbury, it is 856-853-0988. And in Berlin, 856-719-8111, and be looking for that brand new office coming to Washington Township very soon. I want to thank Dr. DeLuca for joining us tonight. Again, he's an orthopedic surgeon with Booth, Bartolozzi, Baldristan Orthopedics and Sports Medicines, sports doctors for the Eagles, Flyers, Phantoms, and Kicks, and also Dave Anselmo for joining us as well. We'll be back 2 weeks from tonight. We'll be talking about joint replacement with Dr. Pure. That's our next program, Thursday night, April 11th. Until then, I'm Joe Chapana. Stay well.
Welcome to Sports Doctor. Sports Doctor is a live presentation, so we encourage you to call into the show and ask your questions on injury, rehab, training, or technique.